Good afternoon. I'm Dr. Shruti Sujay, Medical Retina Consultant at TMS Eye Hospital. Today this talk is mainly to give you an awareness about the complications in the eye that one could have because of diabetes. To start with, I'd like to let you know that diabetes is one of the leading causes of blindness worldwide. And before we get into it, just a brief anatomy of the eye. Now, starting we have the cornea, which is a transparent portion of the eye, and then comes the iris, which is the colored portion of the eye, and then the lens, which is the seat of cataract, and finally our area of interest, the vitreous cavity and the retina. Now, the retina is the most light sensitive area of the eye. So whatever little colors or the light that you perceive or see is taken in by the small receptors present in this area, and that is then sent by the optic nerve to the brain. In diabetes, we can say diabetic retinopathy can be broadly classified as non-proliferative diabetic retinopathy and proliferative diabetic retinopathy. And along with it is an entity called diabetic macular edema, which can coexist with either of these conditions. Now, in diabetes, the blood vessels are mainly affected. The blood vessels which line this entire retina or the light sensitive area is affected. They get damaged and they become extremely leaky. They can leak in small amounts of fluid, sometimes lipid, and sometimes even small amounts of blood. Now, depending on the severity, this can be further classified as mild, moderate, or severe. Now, what I'd like you to note is several of these patients are often asymptomatic, and this is picked up routinely on an eye examination. So when this information is communicated to your diabetologist, he or she may alter your medications so that you can have a better control of your diabetes. Now, sometimes this fluid can also leak into the centralmost portion of the retina, which is called the macula. Now, the macula is what is responsible for your central vision. So when you have a fluid or a lipid accumulation in that area, it can lead to a significant visual loss. But this condition can be treated further by simple injections or lasers. But a long-standing condition may lead to permanent structural changes, which may then be difficult to treat. Now, like I said, the blood vessels are what is affected in diabetic retinopathy, and damaged blood vessels also means there is less amount of oxygen going to the retina. So this starts sending in signals to the body, and there is a molecule which is known as vascular endothelial growth factor, which is being produced. This molecule then promotes the development of certain new abnormal blood vessels. These blood vessels are extremely delicate, and they can just bleed even with the slightest of strain or any kind of a stress. Now, the bleeding can occur within the retina, or it can occur within this cavity, which is known as the vitreous cavity, and this leads to a significant vision drop. So again, what I want you to note is that now several of these patients can have these new vessels growing, but they may be completely unaware of it. If these new vessels are picked up early, they can be lasered, and also the whole visual drop could have been prevented. Now, sometimes these new vessels can continue to grow, and they form a tissue which can pull your retina, leading to a retinal detachment, which finally requires surgery. So to conclude, I would like to say that early detection and timely intervention can prevent long-term complications. So eat healthy, exercise well, keep your sugars under control, and do have a dilated eye examination at least once a year. Thank you.